This is Dr. David Albert at the Digital Health Summit at CES 2019. And I'm joined today by Thomas Riley, the President and CEO of Seniorlink. Welcome.
Thank you, Doctor.
Please start off by telling our audience, what is Seniorlink and what services do you offer?
Thank you very much. Again, I'm Tom Riley, the President and CEO of Seniorlink. Seniorlink is a national company that supports family caregivers with clinicians and technology as they manage their loved ones with complex disease at home.
Well, certainly here we are at the Consumer Electronics Show, and remote monitoring, wearables, these are all connected care, these are all major themes. Tell us how Seniorlink utilizes that type of home monitoring technology to aid in the services you provide.
Well, interesting. I mean, we have a platform that we call Vela that we use. It's a collaboration communication platform that our clinical teams use to communicate directly into the home to the caregiver. That platform is able to take data from any of these wearables, but I might be a bit controversial here in suggesting that the best remote monitor might well be the family caregiver, the adult daughter who is either living in or around the home with enough frequency to have longitudinal insights as to what's going on inside that home.
Well, that's actually not controversial because, you know, in the hospital, I want those nurses to take care of my patients. So, you know, there's the nurse equivalent in the home, as we all talk about the alpha daughters taking care of their children and their parents at the same time. And so I understand that. And do you use remote monitoring, smartphone? What kind of technologies do you use?
So Vela itself is a communication and collaboration technology. You know, certainly in this part of the country, the platform Slack is well known, so it's similar to that. So think about it for caregivers as a special use. The actors inside of Vela can be family members as well as clinical professionals. We will take, as I said, data feeds from EMRs as well as some of these electronic gadgets, as you call them. But again, the premise is that the more that information is readily available to the person who can actually do something about it, not after the fact, not after an incident has occurred, but in fact use that information with some coaching to actually make a difference and have an intervention up front.
I certainly can see that, and you know, moving people to the home from the hospital or from assisted living, wherever, is a powerful paradigm, and patients love it. So what do you see as the future? Where are you headed?
That's great question. So I'll use a terrible analogy, but you know, if you were a family caregiver a year ago, it was like getting up in the morning and trying to start your car and it didn't work, and you called your mechanic, and your mechanic would say, "Don't worry, you got this. You'll figure it out." Thankfully, it's changing. Bipartisan legislation around the RAISE Act this year, obligating HHS to come up with a strategy for family caregivers. The 40th state in the country passed the CARE Act, obligating discharge planners to involve caregivers in the discharge planning process. And the trifecta is CMS is starting to allow MA plans to pay for social determinants of health, which in fact are all about what the caregiver can do on behalf of the loved one.
Well, I can understand that. You know, as we say, when they tell you it's not about the money, it's all about the money. So helping people afford to care for a loved one at home is certainly important. And obviously, Seniorlink enables better care at home. So, Tom, thank you very much. This has been wonderful. Again, Tom Link, CEO, President of Seniorlink. This has been Dr. David Albert at the Digital Health Summit at CES 2019 and hosted by Living in Digital Times.
Thank you.